I am Dr. Adam, and with the Bright Minds at Beatrice, we'd like to take you on a healthcare and wellness adventure with these two delightful helpers, Fizz and Emmy, and a team of specialists, Dr. Saul, the knowledgeable Dr. Aisha, and the professor with unparalleled medical expertise, Dr. John. We'll help the ill family who always think they're ill deal with the many health problems that come their way and learn a thing or two ourselves as we go along. Now, shall we get down to important matters? Because your health matters. At Beatrice, we'd like to take you on a healthcare and wellness adventure with these two delightful helpers, Fizz and Emmy, and a team of specialists, Dr. Saul, the knowledgeable Dr. Aisha, and the professor with unparalleled medical expertise, Dr. John. We'll help the ill family who always think they're ill deal with the many health problems that come their way and learn a thing or two ourselves as we go along. Now, shall we get down to important matters? Because your health matters.
Dr. Adam!
Come right in, Bill. How nice of you to visit.
Oh, Doc. Oh, you gotta check what's wrong. What you drawing?
I believe this is what we call a heart, Bill.
Nuh-uh, that's not a heart, Doc.
Really? Well, why don't you show me what one looks like?
And you call yourself a doctor.
I admit, your heart is quite impressive to look at.
See, what'd I tell you?
However, I doubt that it can help a human function.
I think mine functions just fine.
Fizz?
Dr. Adam?
Dr. Saul, I have Bill here with some questions about the heart. You got a few minutes?
Sure, no worries. Do you mind bringing him in?
What's going on, guys?
Your heart might be able to pull it off in theory, Bill, but reality doesn't work that way.
The cardiovascular system is made up of the heart and blood vessels, arteries, veins, and capillaries that navigate the whole body. The heart has 4 chambers, 2 each on the left and right side. The heart's function is to pump blood all around the body. This blood delivers oxygen and nutrients to the body, removing all the waste. Arteries are blood vessels that transport oxygen-rich blood away from the heart, while the veins carry oxygen-poor blood back to the heart for renewal. Bill, do you know what cardiovascular health is?
I try to stay away from anything that has cardio in it, Doc. It's dying? Why?
Cardio relates to the health of the heart and blood vessels. Not taking good care of cardiovascular health can lead to cardiovascular disease, Bill.
It's probably why you've been massaging your heart this whole time.
Cardiovascular disease is often called heart disease. That refers to conditions affecting the muscles of your heart and the blood vessels supplying blood to the heart, brain, and other vital organs. A problem in any of these can lead to several painful events, like a heart attack, chest pain, angina,
Which is when your heart muscle doesn't get enough oxygen.
or stroke.
Did this room get hot all of a sudden?
You see, Bill, cardiovascular disease is the leading cause of death all around the world. 31% of all global deaths. 31. Why in 2015 alone, 17.92 million deaths were estimated to be due to cardiovascular diseases. In fact, it is predicted that by 2020, cardiovascular disease will be responsible for 25 million deaths, making it a global epidemic.
At this rate, there won't be any more people. Or me! There's gotta be something we can do! Help me, Doc, please!
Chill, Bill. Look at this for a moment. There are 2 categories.
Non-modifiable risk factors are ones we can't change, and modifiable risk factors are ones we can change if we take certain measures. The first non-modifiable risk factor is family history.
If a father, brother, or mother has suffered a heart attack before the age of 55, the risk of cardiovascular disease increases.
Age.
Naturally, if left unchecked. The more you age, the more the risk will increase.
Gender.
Gender plays a big role as well. Men have a higher risk of cardiovascular disease than premenopausal women. However, after menopause, women also pose the same risk.
Genetics.
Having Asian or African ancestry can increase the risk of heart disease.
Socioeconomic standing. Being economically challenged,
Socially isolated, anxious, and depressed are all factors that can affect your heart. After all, there is nothing worse than stress.
It's too late. I can't do anything on that list. Just look at me.
Don't worry, there are some things you can. Being active is beneficial for your blood pressure, blood sugar levels, and health of your blood vessels. Stop smoking. Smoking promotes cardiovascular disease by increasing fatty deposits in the blood vessels and the risk of developing blood clots. A diet rich in saturated fats, cholesterol, and salt increases the risk of cardiovascular disease, and therefore, a diet rich in fruit, vegetables, and whole grain cereals and fish is often recommended. High blood pressure obstructs and weakens the blood vessels and is a risk factor for heart disease and stroke. Obesity may cause high blood pressure and diabetes, leading to a higher risk of developing cardiovascular disease.
Diabetes can seriously damage the blood vessels, further increasing the risk of this disease.
That's a lot of work. Oh.
The best way to maintain your CVH is by following a healthy lifestyle.
Keeping a healthy heart is key to preventing CVD. Keep in mind that regular, moderate physical activity is great for heart health. It helps to lower blood pressure and cholesterol.
Emmy, scissors. Stop smoking, Bill. Oh, seriously? Handle it, Fizz. Incoming.
Stop smoking.
Reducing the intake of salt, fats, and alcohol by replacing them with a diet of healthy foods. You know, fresh fruits and vegetables, fish, and whole grain cereals.
That will bring your BP down too, and helps you lose weight, bringing the risks down even more. As they say, there's no health like mental health. Leading a healthy social life with family and friends can help you keep away from stress and depression. Two things that can give you a first-class ticket to the ER.
Thank you for explaining that, Dr. Saul.
Oh, no problem. Come on, stay strong, Bill. Oh, where'd he go?
Oh, I'm staying strong, all right. I think life was much simpler with my version of the heart.
Nah, he'll be fine. I gotta bounce now, Doc. Catch you later.
Thanks for helping, man.
Always a pleasure, my man. Ciao.
Cardiovascular health refers to the health of the heart and blood vessels. Cardiovascular disease is the leading cause of death worldwide. Multiple risk factors are responsible for cardiovascular diseases, which need to be managed optimally. Poor cardiovascular health can lead to cardiovascular diseases, which have a negative impact on health, quality of life, psychological well-being, and social life. Maintaining a healthy lifestyle is key to good cardiovascular health. After all, your health matters. You can visit the below website to gain more information on health and wellness and access the Health Matters with Dr. Adams' series of videos. If you feel you need further healthcare and wellness information, you may consult with your family doctor.